Hello friends, so welcome to my channel Medico Sara. So discussion of today's topic is diabetes protocol and hypertensive protocol, means how we should manage patients in hospital in medicine ward with respect to diabetes and hypertension in irrespective of age groups, whether it is child or mainly in adults more than 40 or 60 years of age. So diabetes, there are total 8 steps. So step 1 is we have to measure random blood sugar level of all adults. So random blood sugar level normal ranges 70 to 120 or 110 mg per deciliter, and C fasting blood sugar level is 90 to 120 mg per deciliter, and postprandial sugar level is 110 to 140 mg per deciliter. This is normal range. If any of these values is more than, it is termed as diabetes. So if blood sugar level or random is more than or equals to 140 mg per deciliter, then step 2 is we have to check the fasting and postprandial blood sugar level and adherence counseling, means we have to manage the diet plan and treatment accordingly. So step 3 is prescribe medications depending on blood sugar level. So there are 3 cases. If fasting is more than 126 to 180 and postprandial is less than 200, then start metformin for mainly for type 2 diabetes mellitus. 500 milligram OD means once a day, or same fasting more than 126 to 180 as above, and postprandial is more than or equals to 200, then start metformin 500 milligram. BD means twice a day, once a day, twice a day, and TDS means thrice a day. Same fasting level more than 200 and postprandial is more than or equals to 300 milligram per deciliter, then start metformin 500 milligram thrice a day. Then step 4 is after review after 1 month, then blood sugar level not achieved, then metformin same dose and twice a day. If not, step 5 is thrice a day. If not, after 1 month review, add glimepiride 1 mg OD means once a day. If not, then same but twice a day, means glimepiride same medication and twice a day. If not, then after review 1 month, patient has been taking drugs regularly and correctly, we have to check, and if so, refer to a specialist. Then there is an important, means various drugs has various side effects. So see what are the major side effects of the drugs, like hypoglycemic symptoms, diabetic retinopathy related to eye, and diabetic neuropathy related to CNS. So in hypoglycemic symptoms, watch for sweating, confusion, palpitation related to CVS, then giddiness means chakkar, then tremors, irrelevant talk and unconsciousness, or we can say coma, and start treatment with 10% dextrose IV means intravenously, or sugars with orally patient is conscious. Then refer to treatment. Then in case of diabetic retinopathy, examine the retinal fundus every year. Then eye symptoms include spots in vision and blurred vision, then fluctuating vision, impaired color vision, then vision loss, then diabetic neuropathy, examine for feet sensation and circulation, and same referred for gangrene immediately, cellulitis, then treatment with accordingly antibiotics for symptomatic treatment, refer to the specialist if not cured. Then lifestyle management, it is for all patients. See, avoid fasting, stop medication if fasting, avoid sugars, then addiction like tobacco, alcohol, then do physical exercise for if overweight 150 minutes per week, then eat healthy diet like grapes, fruits include banana, grapes, chiku, etc., and eat healthy oils like groundnut or sunflower oil, healthy oils. Then last is blue box, very important. So see, first point is patient found with fasting blood sugar less than 110 to 125 or postprandial is 140 to 199. Then start on lifestyle management for 1 month. See, 1 month prior to initiation of medication. Then second point is with comorbidities, means secondary cause like hypertension, coronary artery disease, chronic obstructive pulmonary disease, chronic kidney disease, then unresponsive urinary tract infections, diabetic foot, then ketone in urine means ketonuria, then start treatment with medications accordingly. Then third point is do investigation like normal creatinine, blood pressure, urine, lipid, ECG, food examination, and serum creatinine more than equals to 1.5, then refer to specialist. Then fourth point is that every month review, ensure treatment adherence prior to stepping up treatment, counseling. Last point is if elderly patient more than 65 years, then blood target should be the fasting is less than 140 and postprandial means after eating food is less than 180 mg per deciliter. Then hypertension protocol, there are 8 steps. So step 1 is measure BP blood pressure, then 140 above, 90 above, then diagnose it as hypertension. Step 2 is drugs, antihypertensive drugs include amlodipine 5 mg and counseling. After 1 month review, if not relief, then add telmisartan 40 mg, then add telmisartan to double dose means 80 mg. If not, then amlodipine, start amlodipine to 10 mg. If not, then add chlorthalidone. It is a class of diuretics. So chlorthalidone 6.25 milligram. If not controlled, then same, increase the dose to double, 6.25 ka double, 12.5 mg. Then last step is if BP is not controlled, then check patient has been taken drugs regularly and correctly with proper time. If so, refer to specialist. Then important points of various drugs and side effects. First, women who are pregnant means pregnancy induced hypertension. So AC inhibitors, angiotensin receptor blockers, and thiazide like diuretics should not be given, contraindication in pregnancy. Then statin means cholesterol lowering agents should not be given to pregnant women. Then CCB means calcium channel blockers should be used. If not controlled with dose, then refer to specialist. Then people with diabetes, so treat accordingly. Aim for blood pressure of less than 140 by 90 mmHg. Then people with history of heart attacks within 3 years, add beta blocker like propranolol, timolol, etc., non-selective selective beta blockers, to amlodipine with intensified treatment. Then people with history of heart attack or stroke begin with low dose aspirin and statin. Aspirin is 75 mg because aspirin has analgesic, anti-inflammatory, antipyretic, low dose, high dose aspirin, various side effects. That's why we have to start with low dose aspirin. People at high cardiovascular risk, then start aspirin and statin. People with CKD, chronic kidney disease, then same AC inhibitor or angiotensin receptor blockers preferred, and specialist if not controlled. Then lifestyle management for all patients. Avoid addictions like tobacco, alcohol, then exercise regularly like 150 minutes week walk. If overweight, then lose weight, add fruits, vegetables, eat less than 1 teaspoon of salt per day, avoid papads, chutneys, pickles, etc. Use healthy oils, polyunsaturated and monounsaturated oils like sunflower, groundnut, coconut, as we have discussed earlier in the diabetes protocol, same in the hypertension protocol. So avoid processed foods containing trans fats and avoid adding sugar. The last step is blue box important. So first, patients with mild hypertension, that is systolic blood pressure and means maximum, or diastolic blood pressure means minimum blood pressure of 140 to 159 or 90 to 99, start on lifestyle management for 1 month prior to initiation of medications. Then second point is patient with severe hypertension means systolic BP of 180 or diastolic of 110, start treatment and refer to specialist. Then third is recommended investigations at initiation of therapy means same as above, means in diabetes all investigations same. Then fourth point, at every month review ensure counseling same as above. Last point is important, if telmisartan means class of angiotensin receptor blockers as we have discussed above in step 3 and 4. So if telmisartan is not available, then replace with enalapril, which is AC inhibitor, 5 mg initial dose and 10 mg means we have to double the dose later with intensified dose. So this is all about protocol of diabetes and hypertension, which we have used regularly in our hospital or medicine practice. So guys, please take a screenshot of this for future reference. First with of diabetes. Then of hypertension. So guys, thank you.